So, David, tremendous meeting here, the AATS Mitral Conclave 2015. I've had people telling me it's the best thing they've ever been to. What are your reflections?
I tell you, Randy, I was just walking out the door of the last session, and someone from Nigeria came up to me, somebody from Colombia came up to me, somebody from Turkey came. It's incredible to see the impact. It's so rewarding to have so many people come up. I had a medical student come up to me from Italy and said, "Thank you for giving a discount fee to medical students."
Right,
It's been such a rewarding couple of days for me personally, as well as just, I think, for all of us that are interested in education, because they're just the energy and the camaraderie, the partnership among the faculty, the interaction with all of these. They're really fantastic physicians in their own right. And yesterday we ran, as I don't have to remind you, from 7 till 7 o'clock.
I remember it.
And then this morning we started again at 7:15, and at 7:30 this morning there was not a seat in any of our rooms.
Right.
And that's what really gets the two of us. If you're an educator, that's what you really want. You want to have a chance to teach.
But it's unbelievable, because I watched yesterday morning coming in and seeing the room packed and the energy of that, and then watching, you're busy running around, we're talking to people, we're interviewing people, we're watching the interaction of people, the learning, as you said, the camaraderie, people with each other. Not only are they pushing the field forward, but they're pushing the relationships forward. So I think this is the most spectacular medical meeting I've ever been to.
Yeah, it was a really, really great effort, I think, on everybody's part. And I say again, Randy, I think that every year we've gotten it better. This is the third one, as you know, and I think that each year we learn some lessons. I will tell you one thing I enjoyed a lot this year, and I'm going to incorporate more in 2 years, were the breakouts. These small room interactions with 100 people.
Right.
Some way that felt more intimate in some of the teaching. So I think we have to continue to evolve. This field will continue to evolve, but I think the foundation we've got right now, I'm really excited about. I'm really excited about the enthusiasm in the international surgical community. 60 countries were represented.
That's
here.
Amazing.
And the other thing, Randy, these are all doctors interested in valvular heart disease. So these are surgeons that are interested in valve disease. That you don't take 2 days out of your practice unless that's what you're interested in, because this is really a lot of information about 2 inches inside your heart. So unless you're interested in this particular valve, you're not going to spend 2 days hearing about it. So I was really excited about that.
And not only about the valve, but the concept of excellence in providing care. Okay, and the way the field is changing. From the very first, when Tyrone was talking about incision types and technique and approach, and listening to Craig Miller this morning talking about excellence and outcome, and as the transcatheter therapies come along, as they will, a lot of discussion here. So it's this whole concept of continuing the excellence in providing the best care for people.
Yeah, Randy, the Mitral Conclave honestly is all about sharing, and I think that one of the best sessions of the whole 2 days just happened. It was the very last session. We've never had this many people at the end of a 2-day meeting after literally 20 hours of non-stop activity. We had so many people there, and it was interesting. One of my partners, Ani and Yanu, had the idea to do complications as the last session, and that was the ultimate sharing, because all of us were up there basically talking about various complications that we've had in our own patients, and I deal with them. And that really captures the spirit of a meeting like this. It's not to show your hardest case and that you do something no one else can do. It's really to interact with the community of surgeons that are interested in mitral valve disease and agree, criticize, question, but leave the meeting a better mitral valve surgeon, and I really think we did that this year.
Oh, I don't think there's any doubt. The spectrum of people you had, as you said, it's very impressive standing around and talking to, our friends and colleagues from Japan, Portugal, all over the place. And so, it's a compliment to you and your staff. I know how much work this is for you and your staff, for the Mitral Foundation, and for AATS. It's a great partnership. Talked to Pedro and Mark yesterday, and they were both excited about this. Yeah. It's grown tremendously. I mean, you had 1,150 people,
Yeah,
surgeons here?
I mean, I can't underemphasize the importance of the relationship with the AATS. That was an early idea. I really never considered doing this meeting without going to the AATS. And fortunately, that leadership team at the time had the vision to let us try and do it and stood behind us. And, you know, there are always some growing pains, but I think we grew up pretty quickly here. And I think that now we've got the perfect partnership. And this is really such an incredible opportunity for me personally to get to lead this on behalf of the AATS, and it's something I'm really grateful
Well,
for.
you've created an environment where learning and relationships are making the field better, and I think that's pretty unique. I mean, and that's shown in, as you said, in this closing session when you're talking about complications. Not too many people want to close a meeting talking about their complications, but that's part of the learning process.
And I think that, Randy, you know, the one thing we did in this meeting that I'm really proud of, I'm a Carpentier disciple. I worked so closely with him for so many years, and as you know, if you look back 15 years ago, there was sort of the Cleveland Clinic camp and the Mayo camp and the Carlos Duran camp and the Carpentier camp, and basically you could take your lineage to one of those. Correct. And that was sort of how you did things. And I really believe that today the concept of sharing, blending, growing has really changed. And I think that every time I come to one of these meetings, I go home with a few new ideas that I'm going to try. And I think that I've seen this happen in the field among not only my peers that are very high volume surgeons, but also from attendees. I think that this has been one of the really exciting things, is getting all of us together that all have different ways we might do something, showing all of those different techniques in a single forum, in a single session. And then that gives you the chance over an hour and a half to look at 6 different ways to treat posterior leaflet prolapse. And I think this is something that has been valuable to me at my level, and I'm sure it's valuable to all the attendees. I think that, you know, one of the best breaks I ever got was when you invited me to this meeting in Echo and Context. I don't know how many years ago that was. It must have been 10 years ago?
More, yeah, at least 10.
At least 10 years. And yeah, one thing I really learned from that, from our friendship over the years, is this importance of friendship among your peers as well as the attendees. You know, you're such a master at interacting with people, and I really think that, you know, I hope I followed your lead. I think that's one of the things that's really been certainly important to me in trying to lead this meeting, and I'm really excited about the future. And I can't not mention the sponsorship this year.
Correct.
The sponsors, all of the companies that came here really came here and did a lot of preparation. They brought all of their products. Surgeons were exposed to anything they wanted to see in their mitral valve practice, and that's a lot of effort because we've got the annual meeting starting tomorrow in Seattle, and I really appreciate their effort to come and enrich the educational opportunity here in this meeting. So I think a job well done. We've got some things that I think we can do even better in 2017, but I'm excited about it.
Well, again, my congratulations to you, the foundation, Mitral Foundation, and everybody on behalf of the AATS. You've done a marvelous job. And certainly you're right. In this time when sponsorship is looked at, you know, in a funny way, the sponsors here have done a tremendous job of furthering the educational mission. So, you know, we want people to join us in 2 years in 2017.
I think it'll be. I don't hope. I know the 2017 conclave will be even better. I'm sure of that. At least I'm going to do my best.
It's fantastic. Well, so you've had a chance to watch a spectacular meeting, and we invite all of you to come back and join us in 2 years. Thanks for joining us.